Well, it's again sort of interesting to me because like the collection of data, maintaining a database, analyzing information, that makes sense, and it's one view of things. It's kind of the public health, epidemiologic approach. Get data and see what it says. And I like that, but what I really enjoy is the clinical care of the patient, which is one-on-one always. I mean, it's one individual. That's what's important. So I guess that's why, I take this approach, and everybody on the staff here, I want them to take the same approach. That's, I think, the only way you can really deliver quality medical care, because if people are just, looked at as a number, or it's a, I kind of worry about if things go in the direction where everything is an algorithm and there's no individual choice, the patient has no say. It's just you get put in, and that's the way it's going to go. It feels like that's not what I want for myself by any means. And so again, I guess that keeps coming back to the issue of informed consent and being able to make choices. That's, I think, part of it, is how do you best make a choice.
What I liked about here is, and I looked at other websites, I looked around to see, I even looked in Atlanta because of working there. I have an apartment there. It would have been very convenient for me to, go to someone there, but everyone was pushing, it seemed like they were pushing more in vitro than the reversal, and that really was not what I wanted. And when I came here, you put it there in black and white, the different options of what you could do, but you backed it up with your numbers. Okay, this is this and this is that. And I liked that a lot. It was by far the best that I had seen, and in my research of everything I was looking at. And I didn't feel like you were pushing this down my throat. You were saying, okay, you can do this or you can do that. And I liked that.
Hearing different aspects of this discussion, one of the reasons that I think it's important to me that people who come here do it with informed consent is that in reality nobody can say in advance what the outcome is going to be. I mean, you can give probabilities based on statistics, and we do it based on our own personal experience rather than trying to either make it up or take what somebody else published and then pretend it applies to us. So,
generic demographic that may or may not apply to your procedures and your methods.
But so we're sitting here today. You just had your surgery, and we don't know what will happen. We have to wait for time to pass. That's going to tell what will happen. We're prepared. We have protocols. We know. We talk about what will, different pathways it can take. But for me, I feel like if each person really thinks about, talks about it, and makes a decision that is best for them, they'll take that responsibility. As Julia said, patients who come here are adults. They're not neonatal or infants like you take care of, and that enables me to be able to best deal with him in the future, regardless of what happens. Someone will get pregnant, have a healthy pregnancy, have a wonderful baby. Maybe they'll miscarry, or maybe there'll be a tragedy and the baby won't be normal, or maybe they'll have an ectopic, or maybe they won't get pregnant, or it could be lots of different combinations. And the nurses here and I are always available, to talk and interact and try to help people at that stage in their life. But knowing that all of these are possible outcomes, I feel as if the best situation, is when each person has really given thought and, come to this conclusion and feels confident it's right for them. Many people tell me, I think I've heard it maybe at least twice today. Now we've done what we can do, and if it's if it's in God's plan, or Providence wills it, we'll have a baby. And that, I think, is actually a realistic approach, because I can do the very best that I know how to do. I feel like I have pretty good experience, having been doing this for 30 years now. But no human being can guarantee or predict this is exactly what's going to happen. So it just kind of keeps the relationship, I think, between the doctor and the patient, or the staff and the patient, on one that is based on mutual respect and understanding that we certainly hope for the best. We want that for everybody, but all we can do is wait and sort of deal with circumstances as they arise. So.